Hi guys, I'm Dr. Iraniha. I'm a board certified general surgeon, and I have been in practice over the last 2 decades in Southern California, Orange County, Newport Beach area. My main interest is minimally invasive surgery, including robotic and laparoscopic operation, and my main focus of the practice is major and complex abdominal wall hernia repair and body contouring. The videos that you're going to see is my experience through bilateral knee replacement. Unfortunately, I have developed bilateral knee arthritis and is associated with the pain and discomfort, and I need to have this type of operation in order to recover and go back to my normal life. And I thought it would be very interesting for people to hear and see my actual experience through this operation for multiple reasons. Number one, it's because of my unique age group that I'm going through this operation. Number two is that I'm going through bilateral knee replacement, and I watched so many videos on the social media, and I didn't see that many people with the bilateral knee replacements and sharing the experience, and I thought might be helpful. And the other last reason is that I'm a surgeon myself, and I deal with patients post-operative pain and discomfort and recovery, and I thought looking at this operation from a surgeon eyes and also a patient perspective might be very helpful, and that's why I'm going to share my experience with you. But again, I'd like to emphasize that I'm not an orthopedic surgeon, and I'm not a certified and licensed physical therapist. So whatever I say in these videos and what you see from my post-op recovery, including my pain medications regimen and also the exercises that I'm going to show you, are not a medical advice. If you have any question or concerns, you definitely need to talk to your orthopedic surgeon or discuss the matter with your certified and licensed physical therapist. Hi guys, this is day number 18 after my double knee replacement. Over the last few days, I didn't take any videos because my progress was a little bit stagnant. Obviously, I can see just a tiny little improvement in my swelling and walking, but certainly I'm walking more. Yesterday we had a big event that I had to move to LA for 1 hour drive and stay there for almost 10 hours, and we did a lot of walk and also sitting. So walking is not causing me that much trouble, but when I sit too long, you really get very stiff in my knee, and it's just hard to get up and move around after that. So I'm trying to extend my knee as much as possible and raise it above my heart, but obviously when you go out, it's just not possible. Today, over the last actually couple of days, I started using this pedal. Obviously, you can use the stationary bicycle, but this pedal actually helps me to improve my range of motion for my knee. One of the very interesting thing that I was told and I couldn't believe that happened to me is really the atrophy of the quad muscles. The quad muscles is a series of the muscles in the front of the thigh that they're responsible to extend your knee, and I was told that it's going to get very weak after the operation.
So almost a month before the surgery, I started actually doing more exercise to strengthen my quad, but it's incredible how weak they are right now. And that really affects my walking, so I'm very slow and trying to focus on my walking to extend my knee at the end of the step by working my quad, but it's just tough. But this biking really helps to release the muscle spasm and then improve my range of motion. Definitely I feel stronger. It's day 18. I absolutely do not feel those fever and chills episodes that I had before. I tapered down my Tylenol, so right now I'm just taking one Piroxicum, which is the anti-inflammatory medication, once a day, my aspirin once a day, and my Protonics, which is basically a medication to decrease the acid of your stomach to prevent the possibility of ulcer secondary to the aspirin. And I'm just taking 1 gram of Tylenol at night, and hopefully next couple of days I will taper that completely off. Now, again, my short goal is to just get better and go back to work. I'm planning to start working in 10 days. So these next 10 days are very, very critical for me to get better and stronger, so I can tolerate going back to my routine. But I'm 100% sure that if I go back to my routine, mentally I'm going to be stronger and I can focus on my rehab a little bit better. Right now it's just being home and not being active. It's a little tough, but overall I think I'm in the right direction, and next week is my post-operative visit. I had to change my top dressing, but I still have some strips on my incision, so they look good, but I'm not sure what's going on underneath of it until I see my physician next week. So I'll keep you posted.
Hi guys, this is exactly 3 weeks after my double knee replacement surgery, and for the first time after 3 weeks I was able to put on my scrubs and uniform and drive into my office and to see actually some patients. So for me it's an incredible achievement after 3 weeks of major surgery, but over the last few days the improvement as far as range of motion has been very slow, but in the right direction. So I want to update you about my health. Since last few days, the swelling of my ankle and rest of my leg are better, and most of the swelling is all localized around the knee. So I'm working very hard on my range of motion, and for some reason, even though the swelling on the left side is worse than the right side, but the right side I'm having a little difficulty with the range of motion, especially flexion, and I get some discomfort on the bone area, mostly on the medial side of my knee when I do the flexion, so it prevents me to do a little bit more flexion every day. So the left side is definitely much better than the right side, but I talked to my physical therapist and they said it's always the same case. Normally one knee is lagging behind as far as the improvement and recovery, and I just have to be patient. So today I'm going to see some patient in my office. Tomorrow I have my first post-op visit with my orthopedic surgeon, and I'm going to ask a lot of questions about what's going to happen, but he's going to take the dressing off and maybe take some pictures to see how the hardware looks like in my knees. And this week is the last day of my in-house in-house physical therapy, and I already scheduled physical therapy for the next week as an outpatient. So I set up everything to go back to my actual work in 1 week. It seems very fast to go back to full duty work, but I'm confident that I can do it. It's not going to be easy, but I think actually coming back to work and seeing patients and performing surgery is going to make me mentally stronger, and so I can focus physically on my rehab. Overall, I'm feeling stronger, but at night I'm still having trouble with sleeping. It's just very, very hard to lay down in one position. I still get discomfort on my knees, but I'm not taking any pain medicine, and trying to use that discomfort as an alarm or warning for myself to move around at night, so I don't put too much pressure on my knee. But overall, when I walk, I'm feeling a little bit better and a little stronger. But when I sit down too long and stand up too long, it gets very stiff. So hoping the next week is going to be a better week, and I will keep you posted. Thank you.